Hey guys, what's up? So in this video we are going to discuss about the anatomy of the retinaculum, which are situated in front of the ankle. So basically when it comes to the retinaculum in front of the ankle, we have we have the superior extensor retinaculum as well as the inferior extensor retinaculum. So we have the extensor retinaculum, we have the superior as well as the inferior one. So when it comes to the extensor retinaculum in front of the ankle, we have the superior extensor retinaculum as well as the inferior extensor retinaculum. So how are they basically situated in front of the leg and dorsum of the foot? You can see. So this is the dorsum of the leg. Sorry if you don't find my diagram very interesting. So we have the superior extensor retinaculum somewhere like this in front of the ankle, and then the inferior extensor retinaculum is like a Y. It's Y shaped like this. This is the stem of the Y shape, and this is the upper Y band and the lower Y band, and these are the extensor retinaculum that are situated in front of the ankle. So when it comes to these extensor retinaculum, we are going to discuss them in terms of the attachments of the retinaculum as well as the relations of the retinaculum. So basically I will be beginning with the superior extensor retinaculum. I will be naming it as ER, superior extensor retinaculum. So when it comes to superior extensor retinaculum, this is actually a broad band of the deep fascia. You can call it as a broad band of the deep fascia, and it is just situated above the ankle, almost up to the width is up to 3 centimeters. The width is up to 3 centimeters. And what are the different attachments we are going to find? The attachments, we have the medial as well as the lateral attachment, right? Medial as well as the lateral attachment. So medially it is attached to the anterior border of the tibia. Medially it is attached to the anterior border of the tibia, and laterally it is attached to the lateral border of the fibula. So the attachments of the superior extensor retinaculum is in terms of medial as well as the lateral attachments, and medially it is attached to the tibia and laterally attached to the fibula, both of them anterior borders, medial attachment as well as the lateral attachment. So this is about the attachments of the superior extensor retinaculum, and further on we are discussing about the relations, right? And what are the different relations we are going to find? We are going to find actually this superior extensor retinaculum, it will actually split to enclose the tendon of tibialis anterior muscle, and the extensor retinaculum will actually split to enclose the tendon of tibialis anterior. And we are also going to find the extensor hallucis longus, the deep peroneal nerve, the anterior tibial artery as well as the extensor digitorum longus. So all of these muscles we are also going to find just below the superior extensor retinaculum. They will be just like simple threads, you can say, like this. So the relations of it, we are going to find the extensor hallucis longus, the deep peroneal nerve, the anterior tibial artery, the extensor digitorum longus, and also the peroneostasis. All of these tendons we are going to find, the muscles we are going to find, and the superior extensor retinaculum will actually split to enclose the tendon of tibialis anterior. That is what you need to remember. So this is about the relations of it and also the attachments of it. So now we will move on to discuss about the inferior extensor retinaculum. So inferior extensor retinaculum, again we are going to discuss in terms of attachments as well as the relations. So actually inferior extensor retinaculum is actually, it's a Y shaped band. It's a Y shaped band, and it's also situated in the deep fascia, and the attachments are, it has the stem and the upper Y band as well as the lower Y band. So when it comes to the stem is actually attached to the calcaneum, which is a tarsal bone, right? So stem is attached to the calcaneum. The upper Y band is attached to the medial malleolus, and the lower Y band is attached to the deep fascia of the sole, of the foot. So it is in terms of Y shaped. We have the stem as well as the upper and the lower Y band. The stem is attached to the calcaneum, which is a tarsal bone. Then we have the medial attachment as well as the the upper Y band is attached to the medial malleolus, and the lower Y band is attached to the deep fascia of the sole. So when it comes to the relations of the inferior extensor retinaculum, So the relations are, we are going to find the stem actually forms a loop around the tendons of extensor digitorum longus. It forms a loop around the extensor digitorum longus and also the peroneus tertius. These are the muscles of the anterior compartment, we will discuss about that. And also the upper rib band and the lower rib band, they are related to the again anterior tibial artery, the deep peroneal nerve as well. So these are the different relations that we are going to find in terms of inferior extensor retinaculum. So finally, what about the functions? So we need to know the functions of the extensor retinaculum, right? So actually it keeps the structures of the anterior compartment of the leg and ankle at position. So the work of the retinaculum are to keep the structures of the anterior compartment of the leg and the structures in front of the ankle in position according to where they should be. So the work is that, and also it also prevents the tendons from actually springing medially. It prevents the tendons springing of the tendons medially. It is going to prevent that, so that, because actually in this position what happens is there is angulation of the tendon of extensor hallucis longus at the ankle. So basically it keeps the structures of the anterior compartment of the leg at position, and also it prevents the tendons from springing medially when the foot is inverted. So these are the work of the superior and the inferior extensor retinaculum. So yes guys, this was just a short video about the retinaculum of the ankles. If you like the video, make sure to subscribe, and you can always share it to other friends and people. Thank you guys, I'll see you in the next video. Bye.